Welcome to Sit and Stay, the podcast that breaks down the challenges of starting and maintaining a mental health practice into digestible chapters. Sit and Stay is presented by RipsyTech, an electronic health record company committed to addressing the mental health crisis in the United States.
Hello, and welcome back to the Sit and Stay podcast, brought to you by RipsyTech. As always, you are joined by RipsyTech Product Manager, Parker Anderson. That is myself. And I am joined by founder and CEO of RipsyTech, Tom Tarshis. Hey, Tom.
Hey, Parker. Good to see you. And for our savvy video watchers of the podcast, they'll notice that you don't have your usual background. What's going on, Parker?
Actually, Tom, I'm recording what the viewer sees is being recorded on my iPhone. What you see is coming from my computer. So, but to describe it for those that, well, for everybody that's not you, it's a minimalist office space behind me. It's supposed to be my way of signaling that I'm moving and we're packing up a lot of stuff in our house, and so things are looking pretty empty over here at the Anderson place. But I think for the usual video people are seeing, it still looks like I've got all the same stuff. So
Gotcha. So the point of my comment was just to highlight your upcoming move to a new state.
So the topic for today is we wanted to talk about we've been talking to a lot of new customers and have been putting together some really useful materials for our customers on how to calculate their own rates for the different types of services that they provide. And in that process, it all relates back to, creating a budget for your practice. Like, understanding what the budget needs to be for your practice also helps inform what your rates need to be for your practice, so you can understand how much you're going to get paid. And, a lot of important information there. And so we thought it would be a good time to create an episode that is, specific to budgets and why exactly they matter for mental health practices.
Yeah, Parker, and I think, as we're getting a lot more users, I think it's fair to say that I have yet to come across any group, whether they're brand new or established, that actually has a budget. And it's one of those, and in fairness, I didn't have a budget when I started almost 20 years ago, and probably not even until 3 or 4 years in did I make the first budget. So not passing any judgment. I think as part of this podcast and running a practice, try to think of things that would have been helpful to know and or
Right.
super helpful now, and just seeing clinic after clinic sign up and not having a budget. If we can intervene a little bit and talk about how it's super helpful to create a budget for lots of the reasons that you highlighted, then we can do some good for people starting their own practices. And
Yeah, and even, it makes sense that you would, you're starting a business, the types of services that you're going to be providing. So, it makes sense that somebody could approach this as simple as like, well, I'll just charge this much per hour and see how much money by the end of the year I end up making, or something like that. It makes sense that one could approach it that way, but let's talk about why a budget itself is essential, even if you're a solo practice starting on the side even.
yeah, but budgets and budgeting, both personally and professionally, and as a psychiatrist, just to jump here a little bit into mental health, biggest stressors that are shared in everyone's life as an adult, it's finances. It's in the top two: finances, and then sex. We've done one podcast a little bit about sex, but So when you've got something that's a huge, oh, well, we had a sex therapist on.
Oh, that's right. That's right. I was like, Tom, when
Parker
did
was
we ever
giving the
talk about
like,
sex?
I wasn't on that one, Tom. What are you talking
Yeah.
about?
No, that's true. We did. We had a sex therapist as a guest. Yeah. Great episode. Go listen to that.
And so when people are stressed about money, it's usually an exercise to relieve that stress is to sit down, have a budget, know where things really are, and it helps for planning, staying calm, growth. Even if you're a solo practitioner, have you done things like figured out how many weeks of vacation am I going to take a year? How many holidays am I going to work or not work? How many hours a day do I need to see patients? Is an hour a 45-minute session? Is it a 55-minute session? There are a lot of intricacies that people don't sit down and plan out. And instead, Parker, kind of the approach you made was like, well, I'm going to work 9 to 5. I'll fill patients in there. Some days I'll have more or less, and this is what I charge. And a lot of it is then, you know, do I have enough to take a paycheck or pay my bills? And there's not really that thoughtfulness around planning for vacations or for time off, or hey, if I want to work a half day less, is that possible? Or how much more would I need revenue would I need to bring in? Or could I cut costs somewhere else? That's all these things when you have a simple, straightforward, easy to update budget, answers all those questions, decreases stress, and makes you a happier person. Yeah, and that is why we are talking about it.
So, I mean, I imagine, the reason why you want to do it is because there might be some kind of risk or blind spot that you could miss by operating without a budget. So, let's talk about what those might be.
Yeah, and I think the biggest blind spot or risk, especially for small practices or for a solo practitioner, is what happens if you can't work. And
Right, right.
well, if you haven't worked out a budget where okay, um, the nice thing about being a mental health practitioner is that if you can still speak, often you can still work. But say you broke
Fair enough. Yeah.
maybe you broke your jaw and you have to have your jaw wired shut for three
That
weeks.
didn't stop Kanye West from what I heard.
Um, I felt like I did pretty good coming up with something that could actually
That
cause
was
you to
pretty good.
not,
That was pretty good.
what's it, or maybe you have severe laryngitis and can't talk,
Okay,
or
okay.
um, and you can't work for 3 weeks. If you have a budget and well, I only need to work X weeks a year, I don't need to panic about this. Um, then you're going to be in a lot better feeling than oh my gosh, I have no idea how this is going to affect me or the business because I can't generate revenue for these weeks. And that those sort of situations only come up when something serious happens, or it does, I need to go, I have a sick parent or child and I need to take time off of work. Not knowing how your business looks and operates, and that time off component that you're working towards, um, is a big blind spot that people miss, and that having a budget can help with. I think the other piece that is a blind spot or that can cause problems without having a budget, is anything to do with growth, either within, if you're ever going to hire another person, or as you are in the practice more, maybe it would be nice to have a part-time administrative assistant come in to take care of some phone calls or other stuff that's less enjoyable for yourself. If you're not
Hmm.
giving yourself a budget and seeing where revenue distribution is going, and is there some money left over, and hey, if I did have an administrative assistant, that actually saves me 2 hours a day. I'm going to add one extra patient in that hour, and now I'm making more money. And if you had never sat down to look at the numbers and think about it, you can miss lots of lots of those pieces. Even past all of that, having a budget forces you to, okay, here's my operating expenses each month, and you will tend to know, okay, it's $500 a month for internet and my sublease and to buy snacks for my patients. If then one month you see that it was $800 or $900, that alerts you that there's a problem there because your budget is usually only around 500 a month. And then you can do some digging and find out that Comcast just tripled your internet fee. So it helps you find missed
Not outside
income.
the realm of possibilities. Yes.
Yes. Yeah.
So, okay, it sounds like when it comes to the expenses that you'd be budgeting for, there are like the business expenses, but then there's also like the people expenses. And when you're budgeting around people, you're not just budgeting money, but you're really budgeting time as well, and understanding, to your example earlier of, okay, well, I'm losing X number of hours, but could, if I was able to work those hours, is it cheaper to pay somebody else to do the work that I was doing those 2 hours or whatever? So, oh, sorry, were you going to say something?
No, no, I was going to let you finish. Sorry.
Oh yeah, no. So I mean, I guess I guess that would be an example of how the having a budget could impact yeah, your growth. And also I'm wondering if is there any way that clinical care can be improved by having a budget? Is there a scenario there?
Yeah. And right. Ultimately, I mean, we've alluded to this previously a little bit that it's an interesting industry because it's a white collar service industry. So it's highly
Mm-hmm.
educated people delivering a service that's generally compensated uh, by time. And so it's much different from having a product that you sell or knowing you need to sell this many products. The way budgets are worked out for mental health practices is figuring out how to quantify your earnings by time, and using RVUs is a good way to do this, which is essentially a metric for capturing reimbursement by time. It would be cleaner if it's just by time, but as we've talked about before in our complicated insurance world and industry, to be exact and precise, which is good with a budget, you having using a RVU system or coming up with some other way to quantify the units of a patient care visit other than
Mm-hmm.
time is going to be helpful. But
And sorry, just to quickly clarify, the RVU stands for relative value unit, and I believe these are units that are assigned to like different types of services that you provide. In that, two services might be rendered within an hour, but might have been more difficult for you to perform as a clinician and might have a higher value unit relative to the other one. And I think that's kind of how I would think about the RVU system.
yeah, and it's a actually very precise way once you have some data to calculate what your average RVU is per day or per hour. And then once you know how much money you're earning per RVU, and then you can figure out how many RVUs a day, right? RVUs a day times how much you're earning per RVU. That's how much revenue you're generating, and you can get a
Mm-hmm.
very precise and accurate model on clinic revenue structure. I think with respect to business growth, if you plan to ever bring on anyone other than yourself, putting together a budget, understanding the extra costs associated with an employee, understanding if is this an employee that generates revenue in a direct way, so another care provider, is it an
Right.
employee that's an administrative assistant, which maybe costs money to have, but they do in turn generate revenue because it frees up more of your time to see another patient if you're in a solo practice. It's very hard to quantify and understand those things if you don't have a budget with categories clearly listing everything out. And that's how growth happens, by looking at historical data for your budget categories, being able to understand your income and expenses. And then, for example, our nonprofit is getting ready to grow and hire more clinicians. When you bring a new clinician into a group, their schedule is not filled initially.
Right.
So we have an idea of, okay, in order for our budget calculations, the clinician needs to get up to 50 RVUs a day. But we know that's not going to happen for somewhere between 2 and 3 months. So how much money do we need to have in the bank to cover the extra costs associated with a new clinician, because they're not generating revenue to the level they need yet? And the only way you know that is by having a budget to precisely look at what that cost is, and then be able to develop kind of sophisticated tracking around, the whole reason I know it's between 2 and 3 months is from years of data that
Right.
After 3 months of a new clinician, we see that their revenue has matched what it should be in the budget. So we have that estimate of the time frame. And that's the piece that helps your business grow and succeed. And lots of people sometimes wind up hiring staff. They don't know about that cost outlay up front, or they miscalculate or don't communicate clearly around work expectations. And so having the revenue goals and those pieces established just helps you do a better job whenever you're hiring someone, of talking about salary expectations, of what the job entails.
So what are some mistakes or misconceptions I can have or make when I'm putting a budget together?
Yeah, I think people are afraid of budgets, and this field, we don't get great training in numbers or business. I forget the financial. There are some statistics about the financial literacy of people throughout the world, or even in the United States, and it is not, as you can imagine. You know, the data is alarming on some level, and the number of the number of people who kind of get their paycheck in the bank and hope it's enough to pay different bills is the majority of people in the country. But I think the biggest misconception, though, is that it is impossible or confusing or so complicated that there's no way you can do it. A business budget it's actually far easier than a personal budget. And if you're very scared about putting the budget together, there are ways to lump things into categories that
Right.
really can make it very simplified.
Right. I mean, speaking as somebody who it seems like a lot. It seems like a lot every time. I mean, even my personal finances, like putting a budget together for the first time, it seems like a lot, but like once you start going with it, maybe I'm a little bit of a freak when it comes to using spreadsheets, but once I got going with my own personal budget, I was like addicted to it. I was, updating things constantly. I'm like, oh, what are different ways I can show the data and look at the trends, and what am I spending on, and how much money do I have for this month so I can buy more video games, or budgeting my time and saying, how much time do I actually have this month to even play a new video game if I bought one, which is not a lot these days.
Yeah. No, and that's exactly correct. And so business budgets are easier than personal budgets, because that's not universal, but with respect to most mental health practices or small groups, after you get to a certain size, it can certainly get more complicated.
Right.
But if you're really just looking at, you could put all of your expenses into probably 5 categories pretty easily. And then you have your income, and you, on your tax return, you or your accountant, you need to put in this information anyway when you're filing your taxes. So yeah, you can come up with a simple way to put together a broad budget that will give you a lot of information that is not overwhelming or scary. And in addition, we for our RipsyTech clients, we have a budget template which is
We do.
very plug and play, and trying to make it as easy and friendly as possible. And I'm very, any new client that says they want to grow, they're starting small but they want to grow a clinic, I push in a mentor type manner to encourage people to get that budget drawn up.
Yeah, and I mean, I think it's one of those things to exactly what you said. Like it really does provide a lot of peace of mind once you have put a budget together, and part of why I feel like so many people struggle with it, or don't know where to begin, is, well, really that they don't know where to begin. So providing something like a template that provides a structure that applies specifically to the type of thing you're trying to budget, aka a mental health practice in this case, can go a long way. So yeah, it's something we're very proud to be offering to our clients.
Agreed.
Okay, so all right, let's say I put together my budget. Am I good to go forever? Do I ever need to touch this thing again?
You,
Or should I be reviewing and updating it?
yeah, right. And so then the hardest piece is that first piece, and putting together your initial budget. The gold standard would be to once a month look at those budget categories, and see how you did. And after you have, most people, they've been in their practice a little bit when they create their budget, and you don't need to go all the way back to the beginning of your company, which is another misconception or fear that people have about the budgets. But if you once you get your budget together, you probably have a couple months of historical data, so you can do some planning around what your budget categories are with respect to expenses mainly. And you should be looking at that monthly to see, look for any big changes that are unexpected between budget categories. And then when you are planning any type of new expense or income, like you're going to be hiring a new employee, or you're moving to a larger office, or yeah, you're going to need to get faster internet because yeah, your video calls are dropping, or maybe you're giving up your space and you're going to do a telehealth practice. That is when you should be updating your budget.
I mean, so yeah, it's kind of like saving up money to cover incidentals and things like that.
And Parker, do you know um, what is the guidelines in your personal
Oh, here we
budget
go.
for how many months of an emergency supply? How many months of your expenses is ideal to have saved up in your emergency fund?
I would say 6 months.
Okay, 3 months is what we hope for, or I shouldn't say
Yeah,
we.
well, I mean 3 months. I mean 3 months is definitely something to hope for. Personally, well, I don't know, in this economy, in this job market, six. I mean, personally, I like to look at my own finances and say, like, all right, how much does it cost to be me every month, and multiply it by 6 and make sure I have that much saved in a high yield savings account.
That, hey, good for you, Parker, and that's cool. As your expenses are about to drastically go up next month, maybe that will come down to three months. But yeah, I
Yeah.
mean that we it's the same sort of rule with your business, that it'd be nice to have 2 or 3 months of reserves on hand, if something were to happen to your ability to generate income or something else goes wrong with the business, it gives you that peace of
Right.
mind that you can continue to draw your paycheck. And so that is the same rule for, keeping your budget up to date, being aware of things that change in your group or your practice, and making sure you have enough cash on hand to weather some difficult times.
Okay, well, this is just the first part of a planned two-parter on talking about budget. So next time, right now we're just kind of covering like what is a budget, why is it important, what might you be doing with it. Next week we're going to talk about how to kind of build and really use that budget. So look forward to that. So before we end things, I know we talked earlier this week about the mental health business moment this week, and I feel like it tied. I can't quite remember what it was, but I do remember it tied pretty well to this topic. So let's talk about it.
Yeah, I mean, it's another, uh, it's a ridiculousness on some level about the sales tactics and negotiation tactics used, determining whether people can get mental health care. And
Mm,
it still what was negotiating with an insurance payer that we are not in network with, because the rates that they offered on the in network piece were um, laughable, should I say? Maybe not laughable, but disrespectful. It's so
I mean, I saw the
low.
numbers; they were like unfathomable. Yeah, they were low.
And so, we had a patient in need, and, you know, they were able to call to their insurance and talk about getting the single case agreement and got the ball rolling. And so, they initially said, "Will you accept these rates?" Like, and I was like, "These were the rates you tried to offer in network that are so absolutely not." I said, "Here are the rates." Then about 20 minutes later, they immediately increased the rates by 250%, but it still was not reasonable. And I'd say, in this realm of negotiations with insurance companies with millions and billions of dollars in profit, that these numbers, um, that, it's still just a shocking how it goes into these, like, why does there need to be so many negotiations? Can't things just be reasonable up front? I think
Hmm.
because of some subconscious anger towards this one company, I still refuse to yield on what the on any further negotiation. And ultimately, they agreed to the rates, which were some 400% higher than what was initially offered. So, I, I, it's good to know that we can get care for the patient. It's ridiculous and disheartening to have to use almost 2 decades of experience to play hardball just to get insurance coverage for a family that's suffering.
Hmm.
Um, but knowing my budget, knowing my budget, it does help with empowering me to say, yeah, no, this is what the number is, and this is reasonable and justified, and that is where we're going to hold the line. And yeah, glad it worked out for the family. And maybe it's a step towards
Yeah.
getting this insurance company to offer a regular, more reasonable rate, so it doesn't have to be these sales negotiation tactics for each of their patients.
Well said, Tom. Well said. All right. Well, I mean, hey, if that ever changes and you ever do go in network with that company, let us know. I'd be curious to know. All right. That about does it for this week's episode of the Sit and Stay podcast, brought to you by RipsyTech. If you enjoyed the episode, we would love a rating and a review wherever you're listening. And if you'd like to get excuse me, if you'd like to get in touch, you can always email us at sitandstay@ripsytech.com. All right, Tom, it was great. I'll see you next time.
Thanks, Parker. Have a good one.
Thank you for tuning in to this week's episode of the Sit and Stay podcast. Until we meet again, we invite you to sit and stay with the ideas and stories shared today. Dive deeper into how RipsyTech can support your practice by visiting us at RipsyTech.com.